Hi everyone, welcome to my monthly video chat. I'm so excited that everybody is here. It is my monthly chat where I interview birth professionals in the local Boston area. And for those of you who don't know, I'm an acupuncturist. I have an office in the Fresh Pond Mall in Cambridge, and I focus primarily on fertility, pregnancy, and women's health. But today I'm very excited because I will be interviewing Joyce Kimball. She is a home birth midwife, a doula, a birth educator, and she has so much to offer pregnant and birthing moms. So Joyce, thank you so much for joining me today.
Sure.
I have tons of questions to ask you, but I think because so much of your practice is home births and midwifery, I think one thing that people are unclear about is what is the difference between a professional, like home birth midwife and a nurse midwife. So can you tell me just kind of briefly what's the difference there?
Sure. So a certified nurse midwife is someone who has gone to nursing school. She has a bachelor's degree in nursing, and then she's gone for 2 more years of midwifery training. And she sat for the boards, and she became a certified nurse midwife. Mm-hmm. And in most states and most certified nurse midwives work in hospitals. Some work in birth centers, and some do work from home, but most certified nurse midwives attend births in hospitals. So they became nurses first, and then they went on for their midwifery education. A certified professional midwife, I didn't become a nurse. I did that later. But,
I saw that, yes.
Midwifery school, and there's kind of 2 ways to become a certified professional midwife. You can do kind of the homeschooling method. They call it the PEP process, and you do an apprenticeship, and then you sit for the boards. Or you can go to what they call a MEEC accredited school, and then have an apprenticeship and sit for the boards. The board exam is the same, whichever avenue you choose to take when you're a certified professional midwife. There's just kind of 2 prongs. And there's lots of conversations in the certified professional midwifery community about those 2 prongs. But I am not a nurse. I'm not a doctor. I didn't go to nursing school. Later on in my midwifery career, I did go to nursing school, and I did become a nurse, but I don't practice nursing.
Yeah.
So most certified professional midwives attend home birth, and certified professional midwife, it's almost exclusive training in out-of-hospital birth. Uh-huh. So many certified professional midwives do birth center birth and home birth. Most, I don't know any that have hospital privileges and catch babies in hospitals.
Mm-hmm. Okay, all right. Because I think one of the things that you and I were talking about briefly before we started was that so many women that I talk to who are pregnant, and because I work so much in fertility, I get to see people very early on when they are just sussing out their options about birth and thinking to themselves like, oh, okay, now I'm pregnant. How do I want this to play out? What are the real things that I want? Which is what I always encourage them to think about. But they're oftentimes expressing to me that they want the benefits of a midwife, and so they might be looking at, I think, nurse midwives. But the discussion that I'm having is what they really want is they want all of the benefits of a midwife, the attention, the caring, the respect, that sort of thing. But they also want kind of the perceived safety of a hospital. And so it's a tough conversation to have from my perspective, because I don't want to take that away from them, but I want people to be very educated on the pros and cons and what safe really means about home birth versus hospital. So that is a very long way of asking you, can you talk to us about this idea of perceived safety? What does it mean to have safety around birth in regards to home birth and midwifery?
Right. Well, I like the way you say it, the perceived safety. That's a neat way to talk about it. And you're also talking to a population that has gone through, or maybe part of your population has gone through fertility treatments. So it's hard to walk through that process, trusting what's supposed to be a natural process, and it's supposed to happen naturally, and needing to use reproductive technology to get pregnant,
Yep.
and then kind of make this leap into, you want me to trust that my body's actually going to go into labor and push a baby out?
Yes.
So it's a huge mind shift.
And I think also the safety piece of it is so huge for women who have struggled to get pregnant in the first place, because they can't risk anything in regards to this pregnancy. They just, not
Right.
that anybody can, but there's, I think, a heightened maybe fear in that regard.
Right. The funny thing is, we feel like if we just did X, then everything will be okay.
Yeah.
And if we only do Y, then I'll never have a miscarriage, and I won't have a stillbirth, and nothing bad will happen. Our culture has no tolerance for bad outcome,
Yeah.
even though, right, car accidents happen every day and things like that.
Yeah.
So in the maternity community, providers said, okay, if we don't want any cerebral palsy, we will monitor the crap out of you. We will put you on a monitor from the moment you go into labor, and we'll put those belts on you, and if there's a blip, we will rush to a C-section and we will prevent cerebral palsy. So it didn't work.
Yeah.
We now do more cesareans for non-reassuring fetal heart tones, and we didn't reduce the incidence of cerebral palsy.
Yeah.
But doctors still sued for cerebral palsy, and so we have this the multi-factored litigious society, very risk-averse, right? And wanting perfect birth, perfect baby.
Yeah.
And then we've over-medicalized, and with the over-medicalization, we have caused more maternal mortality and baby injury. So women who, get the full medical treatment of induction or augmentation, or even IV fluids and episiotomy and a vacuum extraction and epidural and all that other stuff, we have this perception of safety in medical treatments because that's what got them pregnant.
Yeah.
And we find that the medicalization of birth has actually increased maternal mortality in the past 15 years. And birth is as safe as life gets.
Yeah.
There is a perception that if you have a baby in a hospital and the baby dies, that everything possible was done. But if you have the baby at home and the baby dies, it's because you had the baby at home. It's the same risk, whether you have your baby at home or in a hospital.
Mm-hmm.
And I should say, at home we take low-risk moms who, with a well-trained provider. It's not like we are going in the backwoods with your neighbor having your baby at home.
Right.
So
this is a controlled environment with trained professionals who do this all of the time. And not only that, who are incredibly caring and dedicated to their professions in most cases.
Yeah, and we were just talking earlier about how, that one-on-one continuous compassionate care can be the number one factor for a great outcome for a birth. I mean, so it's, 4.3 million babies are born in the United States every year, and our society has developed a system for coping with 4.3 million babies, and unfortunately, it's fairly systemic, and it's rote, and you get induced, and you get an epidural, and with that medical intervention comes risk.
Yeah.
So, I can point to, I have like 14 studies here that talk about how having a baby at home, if you're a low-risk mom with a well-trained provider, we bring everything to your home that you would get at a birth center.
Yeah.
It's as safe, and for some women safer than having the baby at the hospital. Moms have a higher risk of infection, of blood loss, of edema, of all sorts of things that are unnecessary.
And that's not even to talk about the things that aren't necessarily a scary risk, but are just at least an inconvenience to women, like recovering from episiotomies and what is happening in regards to pain and contractions if you were maybe induced with Pitocin, or what happens with breastfeeding and the baby's kind of comfort levels and, irritation levels given these medications during labor, all of those things that are maybe disrupted and inconvenient and uncomfortable and unpleasant, they maybe aren't a scary risk factor, but they are significantly impacting the patient experience, or really I shouldn't even use the word patient, right? But the woman's experience. Those things I find are totally disregarded in medical care. But in home birth, I think they are, on the forefront.
Mm-hmm.
Do you feel that way? Yeah.
I do. The studies show that 25 to 50% of women experience some form of obstetrical trauma or violence during their experience. It can be as benign as someone being told they have a lazy uterus, to getting an episiotomy without consent and saying no, or having a vaginal exam without consent, or all the way through to having what they would consider an unnecessary cesarean, or something very real like the baby's heartbeat went too low for too long and they had an emergency cesarean. Yeah. So there is medically induced sort of obstetrical trauma, and then there is, kind of the experience of birth can be very traumatic. Having a home birth midwife, she's with you. You've hired her. Mm-hmm. You're not getting the practice. You get the person that you have spent 9 months with. Yeah. Our prenatal visits are an hour plus. We stay with you from beginning to end. We do way more postpartum care in your home, tucked in your bed. Yeah. And we also have the opportunity to kind of not reframe, but let's talk about your choices. It's slower, it's kinder, it's customized to you.
Yeah. I think I read, gosh, I don't know if this was an Ina May Gaskin book, but somewhere I read, and I think it was, I can't remember if it was focused on doulas or midwives, but basically both apply, that when you're with somebody, a professional who is one-on-one with you as a birthing mother, that they're with you the whole time. Every minute of the birth, someone is right there with you, paying close attention to what's going on. And so they can see the tiny little ripples in the water that might lead to something bigger and intervene or guide or coach at that moment, as opposed to a hospital experience where there may be 1 or 2 hours, or I don't even know, you could tell me more than that, where you're in a hospital room alone with no one watching over you.
Typically with your partner.
Yeah, but not with somebody who's trained in any kind of birthing. Right? And so it's like, they come in, they check the monitors, and all of a sudden things go from no concern at all to, something's happening here, and we're rushing into something. As opposed to, we're here minute to minute, monitoring the progress, watching what's going on for you as a birthing mother. And you can see, I'm pretty sure it was Ina May Gaskin, she said, they can see the ripples in the water, just the tiny little of something, and really approach that so much earlier than if it had been going on for 2 hours, and then all of a sudden your OB's just kind of checking in on you during the rounds, and oops, wow, there's something that needs to be addressed here. So that to me is one of the many, many huge benefits of really having a one-on-one provider with you.
Yeah, it's very, when I notice that someone is really vocalizing a lot or vomiting a couple of times, I'm there, I know how much they're vomiting, and I know how much they're vocalizing and blowing out all that liquid, right? So I know how dry she's getting, and I can watch and how much she's sipping water, and is it just water, or is there also some minerals in that one, and is it coconut water? So I am just always checking,
right?
Just visually to make sure that we're headed in the right direction, and we're not headed down the dehydration path, or muscle cramps on top of your contractions and things like that. Yeah,
I love that. That feels so much more supportive, and so much more. Or it feels like it provides freedom to mothers during the birthing process. But it's an exciting option for ladies. So I know that you also provide doula services in addition to actually catching babies. And one of the big questions that I often encounter in regards to patients about whether or not they want a doula is, look, what's the difference between a home birth doula and an in-hospital doula? So what they're often saying to me is like, well, I'm going to be in the hospital, I don't need a doula. So can you tell me a little bit about what a doula's role is in general, but also does it differ when you're at home versus when you might be birthing in a hospital?
Sure. When I started out this life path in 2000, I attended many births as a home birth doula and many births as a hospital doula. So first of all, a doula provides emotional, advocacy, informational, physical support. Mm-hmm. So she does not provide clinical care. She's not responsible for the health and well-being of mom and baby, home or hospital.
Right.
Lots of information, lots of advocacy, lots of position changes and physical support, and again, that reframing and the coaching, that kind of stuff. So as a doula, I typically meet with folks about 3 times during pregnancy. We talk through all the choices that you might get offered. I don't care where you have your baby.
Right.
I've been to birth centers and hospitals and homes. The thing is, for a hospital, we tend to have to write a little bit more comprehensive birth preferences. Mm-hmm. Right? In home, it's always delayed cord clamping, and it's always skin to skin, and it's always no episiotomy, and not always, but 99.9% of the time. So there are some things that come up in hospitals that are very routine that most folks who want a doula don't want. So we need to let the hospital know that this person's just not wanting kind of the standard course of care. Mm-hmm. So I do the same kind of physical support, emotional support, advocacy, information, reframing, whether I'm at home or in a hospital.
Yeah.
I actually have to work a little harder in the hospital.
Yeah.
Because the nurses are amazing. They are phenomenal, but when you're dilating, you tend to have more than one patient or client, and then when you're pushing, you tend to have a nurse with you at all times. But the actual, your care provider, your certified nurse midwife, or your OBGYN is not typically with you for more than, 10, 15 minutes every 4 or 5 hours. Mm-hmm. So I have a lot more freedom of movement, as does the woman, right?
Yeah.
At a home birth, right?
Right, absolutely.
There's no hospital bed, and we squat and do hands and knees, and we sit on the stool, and we get in and out of the tub in the shower. There's tons and tons and tons of flexibility. And the hospital's just a little bit more, they don't want you to have your baby on the floor, and home birth midwives don't mind if you do that.
Right.
So I get to love people up when I'm a doula.
Yeah.
And just provide them intuitively either what they're verbally asking for, or what I can, when the sweat is dripping down her forehead, I go get the cold cloths. If she throws up, I'm going to get the bucket. Mm-hmm. And if he's kneeling next to I'm going to put a towel underneath his knees.
Right. And
get him something for him to pour the water over her belly, and just make the birth experience as warm and as comfortable as it can be.
Yeah, absolutely. Yeah.
It's nice. I like being a doula. I don't mind attending hospital births. I attend.
Yeah.
I've probably attended about 650 births, and maybe over 200 are doula births, mm-hmm. and it works.
Yeah.
Yeah, it works.
Yeah, I'm with you. I think doulas have, I don't know if it was arguably more, but they have a huge role to play in hospital births, and they're absolutely as much needed, appreciated, and valued in a hospital birth situation as they would be in a home birth situation. And I also get a lot of talk because, like I said before, I'm in this position where I get people who are newly pregnant, and so I can start kind of planting some ideas about what they might want to start thinking about early on. And I always talk about doulas because I think they're worth their weight in gold. But people often will say things to me like, well, my husband or my birth partner will be there. I don't think I need a doula. And I always try to extend the conversation when people say that, because I just think there's so much to offer in regards to that one-on-one, educated, professional knowledge about what is happening in birth and how to support a woman who is birthing.
Right.
And that...
I tell people I'm a walking childbirth ed encyclopedia.
Exactly.
Like, you go to childbirth education series and you try to retain as much as you can, but I'm a walking encyclopedia. And my job is not to take the partner's role, it's to support the partner so that the partner can support the mother.
Exactly.
But the partner and the mom are having the baby, like, together.
Yeah.
So I'm supporting the team. I'm not elbowing the partner out of the way.
Right.
I'm going to help you get your baby out. And some people really do want me to, like, have their baby for them.
Yeah.
Or they want me to fight with the hospital, and I don't do that. My job is not to get in the middle between her and her partner, or her and the hospital staff. I don't fight with anybody. It doesn't behoove anybody to have adversarial relationships. So I'll say to Nurse Jane, what's your favorite pushing position? Can we try that? We've been, on our back for half an hour.
Yeah.
Or dads or partners are sometimes blown away when women vomit after every third contraction, or when just about, 90% of the population, when they're in transition, says, make it stop, I can't do this anymore. It's so hard to watch someone you love work that hard.
Totally.
Right? It's incredibly hard to watch. So I think doulas are amazing. I have someone who comes to most of I would say 70% of the home births that I do, we have someone who provides doula services.
Right.
When I'm a home birth wife, I can't stay awake 24 hours. I need to really be rested when your baby comes out.
Yeah.
But early labor support, and when it's annoying and you can't sleep, but you can't sit down and you have to walk around, it's really nice to have a doula support. And then, she stays for the whole thing and helps with nursing and takes lots of pictures, and it really, doulas are amazing.
I totally agree.
Yeah. In both locations.
In
all locations.
Yeah, I agree. And I love the idea. I love just thinking about the piece of it is that it's a couple's baby, and they're having the baby together, and you're here to support them, because I really do feel like that I've seen so many wives, and I don't know if it's more often when it's a husband, but it feels like they're being replaced, and that's just not at all the case. And
not at all.
And I feel like also, when you're watching someone that you love very much go through something that sometimes is hard and sometimes is uncomfortable and at the very least is intensely emotional, you're going through that too. And it's hard to be able to think about things like putting a blanket under your knees or getting water and those sorts of things for somebody. So it's as much support for the birth partner, I think, as it is for the women. And I just think, I think it's hugely valuable.
Right. A lot of providers, when a woman gets a show, they're like, they see blood and they're like, is that normal?
Yeah.
And they see it in the toilet and they are worried it's blood.
Right.
I because I have seen so much birth, I can say that is a really normal amount. That is very normal capillary release as your cervix is thinning out.
Right.
But you just can't learn enough of childbirth ed to know all of the possible things that could happen. She has broken blood vessels in her eyes. Does that mean that she's going to be blind? And the baby's heartbeat went down when she pushed, and then it's coming back up, and that's freaking me out. And why is that happening? And so we can, it's like having a walking childbirth ed encyclopedia for both of them. Mm-hmm. It really is for both of them. In a way, mom's doing her thing. She's in. Like, I'm really providing physical support to her, but I'm really providing emotional support and just informational support to the partner. Totally. Because he or she is typically like, whoa, is that normal? know that they last that long. The contractions seem to go, why are they peaking so quickly? There's so much variability, and there's just so much to kind of take in. So, yeah, I am definitely, as a doula, a support for both.
Yeah. Well, I have many more questions that I could potentially ask you, but I think that we should wrap it up today. And I do feel like we talked about some really important things. And I really thank you so much for your time.
Sure.
Can you tell us how people can reach you?
Sure. So I am an email goddess.
Yeah.
I love email. You can email me anytime. I'm Joyce Kimball 3, the number 3, at gmail.com.
Okay.
You can call me, 508-728-6588. I do have a website. It's www.birthservices.net, N-E-T.
Okay, great.
And I'm very vocal on Facebook.
Yes, I love that.
I am on Facebook all over the place.
That's so fantastic. I love it. Well, it was so nice talking to you today, and I really appreciate all the value you added and everything you taught us, and I look forward to connecting with you again soon.
Great. Thanks, Angela. Okay.